The Opioid Crisis Needle Exchange Centers by Avery, Grace, Kennedy, and Rachel Z. Overview of the opioid crisis. It was declared a public health emergency in the U.S. in 2017 due to rising overdose deaths and addiction rates. It began in the late 1900s when prescription opioids were heavily promoted and widely overprescribed. This crisis now includes prescription opioids, heroin, and synthetic opioids like fentanyl. More than 100,000 people die each year from drug overdoses, with fentanyl being a large percentage of those. The opioid epidemic affects families, community, and the healthcare system. It places a heavy demand on the emergency departments, addiction centers, and mental health resources. Although it became a declared public health emergency in 2017, its roots go all the way back to the late 1900s. At that time, pharmaceutical companies assured doctors that opioids were not addictive, which led to them being widely prescribed for pain. Unfortunately, many patients became dependent, and as regulations tightened, some turned to street drugs like heroin. Today, fentanyl, a synthetic opioid that is extremely potent, is behind a large portion of overdose deaths. More than 100,000 Americans die each year from drug overdoses, and this crisis affects all areas of life, including family stability, employment, and the housing. It also puts a major strain on healthcare systems. Emergency rooms are dealing with overdoses daily, and long-term care facilities are seeing more patients with addiction-related health problems. As future nurses, it is important that we understand the full impact of this crisis so we can provide safe, compassionate, and informed care. The pros of needle exchange centers. Needle exchange programs help prevent the spread of infectious diseases such as HIV and hepatitis B and C. These sites encourage safe behaviors by promoting access to sterile equipment and safe disposal for used needles. Many programs offer connections to healthcare, addiction treatment, mental health services, and other systems. They help reduce public needle litter, which improves safety in communities by lowering the risk of accidental needle sticks. Programs build trust with users through non-judgmental care, which increases the chance of long-term recovery. Research shows that they are cost-effective public health interventions that lower the financial burden on hospitals and public service centers. Slide 2 focuses on the benefits of needle exchange programs, which are often misunderstood. One of the biggest advantages is